Hello and welcome to the Tuesday, July 7th Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I'm here with Incident Manager Dr. Stu Kennedy. Dr. Kennedy, so one of the stipulations that makes it so that we are able to provide the non-essential services and elective surgeries is our occupancy, and we have to keep that below 90%. And occupancy has been climbing, and certainly over the weekend it climbed quite high. There are patients now in the emergency department who have been admitted, and they're waiting in the emergency department for beds to become available. And we haven't seen this since the pandemic began. What is happening?
Well, it looks like we're getting back to normal business, Tracy, which is good. It looks like our patients in the community are using the resources we have, using our healthcare sort of manpower to deal with many of their needs that have gone unattended during COVID-19. So we are seeing increased volume of individuals coming through emergency. We're seeing increased admissions to our hospital, and these are all required admissions to take care of the health of the population of Thunder Bay. Is concerning. No, we're at 90% occupancy now, and we're instructed by Ontario Health to make sure we keep it 90% or below. But occupancy is sort of a moving target. So one morning we may be at 92%, and the next morning we could be at 85%, depending on the amount of illness in the community, depending on the amount of admissions and discharges, and the amount of elective surgery taking place. So we have some control over those factors, but we don't have a lot of control. So we know it's a guideline to keep it under 90, and we will do a good job to move in that direction, but we still are required to take care of the health of this population. And as you recall, probably sometime in the fall of last year, we were at 110% capacity. That's not a safe way to practice medicine either when you do a lot more hallway medicine. And these days with social distancing and COVID-19 still in the community and still in Ontario and still in Canada and spreading like wildfire in the United States, we still have to be cautious to keep enough capacity for any type of COVID-19 patients or any type of influx of COVID-19 into our community. So we're continuing to ramp up services, both elective procedures in surgery as well as diagnostics. We're now looking at 75% this week of those services, some departments at 100%. But remember, we still have a major backlog of our diagnostics, of our surgery. There's lots of pain and suffering going on, so we need to get back to normal business, but a different type of normal where we have to sort of really make sure we concentrate on not keeping individuals in hospital for a long period of time. As soon as there's capacity in the community, as soon as they've stabilized, we will be sending individuals home with home care services. So it takes a real cooperative effort of all community providers to make sure we have the capacity in the city to take care of all of these patients. So we maintain our occupancy under 90%, but also the health care of all individuals are being taken care of.
Okay, so the reason for the 90% occupancy then is so that we can respond should there be an influx of COVID patients at any point.
Yes, and we've been very fortunate so far, but certainly other areas have not been as fortunate. And once, as we said last week, once the travel restrictions have been lifted, which they have been outside of northwestern Ontario, we do expect more COVID-19 cases to be coming to Thunder Bay because of the travel. But even Toronto and Eastern Ontario are doing quite a lot better now. They're under, I think, 130, 140 cases each day. That's sort of where it was at 350, 400 some days. So I think we're doing a lot better as a whole, both Thunder Bay, northwestern Ontario, and Canada. So I think we're doing a great we're doing enhanced type of safety precautions that is really going to be good for Canada. And I think it'll decrease our level of transmission in Thunder Bay as travel restrictions open up.
Yes, knock on wood, we've been doing pretty well so far. I just wanted to ask you to comment a little bit. You mentioned some partnerships, some of the strategies that help us to keep the occupancy low. Does that mean discharging patients early?
We will not discharge a patient until they are medically cleared and they're safe to go home. And there's also services in home that actually will take care of their needs as required. So sometimes the patient feels they are not ready for discharge, or family feels they're not ready for discharge, and we certainly appreciate that, and we will have sort of family meetings to determine that. But in other areas, once they're medically cleared from a physician and nurse and professional staff perspective, we need to make room for the next patient coming in who has higher priorities. No longer do we have the luxury to keep people in hospital to totally control certain medical conditions that can be treated at home. So we treat healthcare as a community responsibility, not just the acute care setting at Thunder Bay Regional Hospital.
Okay, and a lot of partners involved in that decision around discharge or a person's next stop on their care journey.
A lot of excellent partners, and certainly follow-up was required both with their primary care physicians or their specialists, and we are doing a number of initiatives here at Thunder Regional Hospital that will go to decrease the length of stay. And that's looking at sort of a timely sort of follow-up clinic for internal medicine individuals, a timely sort of step-down unit, surgical step-down unit, and certainly a short stay unit. But those are going to take several months, those initiatives to come into place.
Right, okay. So for right now, it's about balancing those elective surgeries and other non-essential services and this capacity. And Tell us a little bit about how we can continue to increase those without further increasing capacity.
Well, we always, illness in the community always fluctuates. And certainly we're going to have waves of illness, certainly during the flu season and early fall or the fall time, early winter. And we're going to have a capacity issue to deal with. We hope not to get back to the strain we've been in the past, but there is always that possibility because an acute care setting certainly has to take care of all the acute needs of the population. But we do have to do business different. Everybody who comes to the hospital does not have to be admitted. As long as there's timely follow-up in the community with their primary care practitioners or with their specialist, as long as home care is on board to make sure that we can discharge somebody to a safe home environment, as long as family has a responsibility to also take care of their loved ones. We cannot do it all here at the hospital, so there is a communal responsibility for family taking care of the patients. Our great partner, St. Joe's Hospital, they've been excellent in having taken care of our patients who need extra care. Long-term care facilities certainly are there to support, but we have a strain on our long-term care facilities right now regarding not a total, good number of beds to support the needs of the city. So it's going to be a struggle being one acute care setting in the Northwest servicing 250,000 people, with the next major academic center some 900 miles away. So we're the only show in town. So we are going to be faced with challenges with capacity, and I'm not going to sort of bury my head in the sand because that is a possibility, but we will actually come up with innovative answers that address those concerns.
So the numbers of people that we're seeing coming in, particularly through the emergency department, who need to be admitted, as in, they are ill enough to require hospitalization, that is slightly increased as well. Is that a result of people having had to wait for some of these non-essential services?
No, I think there's a number of factors. There's never just one issue. I think a lot of individuals feel safe to come to the hospital now. They know there's not a lot of COVID-19 in the community. In fact, we only had 2 hospitalized at this point in time, and we only have 1 or 2 active, sort of cases in the community. So I think they're feeling safe. They're also feeling safe that when they come to the hospital, all the precautions are being taken care of with the PPE supply and the individuals caring for you are protecting themselves and protecting yourself from any spread of the COVID-19. So I think there's a relaxation of the anxiety that's occurred in the community for the past 3 or 4 months. I think that's probably the major factor, but also summer months, you're out there, the nice weather, you're doing things that you haven't been able to do for the past 3 or 4 months. So there's more sort of mishaps, there's more accidents, there's more areas or illnesses that are sort of brought on by the environment and the environment out there. So there's more accidents, and so we see more patients in the emergency department, plus the backlog of patients that were waiting at home patiently for them to feel more comfortable coming to the emergency department.
Right, makes sense. So you talked about protecting ourselves from the spread of infection in that, and we have a bit of a development in terms of the mandatory mask use here at the hospital. So as of Monday, people can expect that they will have to wear a mask when they come into our hospital here. What are your thoughts on that? We have seen some support. Toronto has made masks mandatory citywide, Ottawa, and actually Mayor Morrow issued a media release just today suggesting that maybe Thunder Bay do the same.
Well, starting at the hospital level, we know the scientific evidence presents itself that masks prevent spread of infection from you to somebody else. We have a very vulnerable population here in the hospital, and certainly we cannot keep our 2-meter distance all the time, so we will make it mandatory. And how we're going to do that is going to come out on Wednesday at our IMS structure meeting, and we hope to make a formal announcement with timing when that's going to occur. But we suspect Monday would be the date that we're going to put mandatory masks here at Thunder Regional Hospital, like many hospitals in Ontario. As far as the city goes, that's out of my control, but I certainly appreciate the efforts of Mr. Morrow. I think it's a good idea. It's not a popular idea. Individuals are not going to want to wear a mask, but it's a respectful thing to do. And you want to make sure that the person on the other side of the counter, the person you're sitting behind in the transit bus, you're protecting your spread of infection to them, especially because there's so many unknowns right now once we open up travel. You can see what's happening in the United States and in other communities in Ontario and Canada, that there is more spread once travel opens up. And so I think it's a good thing to do until we know more about how we're going to be affected by Wave 2, if we get a Wave 2. So I'm all supportive of mandatory masks. But there will be exemptions. So not everybody can wear masks. You know, a lot of children can't wear masks. People with some respiratory sort of illnesses cannot wear masks. So when they do become mandatory and you see somebody not wearing a mask, make sure you're kind, because there's a reason why they're not wearing masks in most cases.
Yes.
So I think it's a good idea. I think we're going to move forward with that. It's going to still a hot summer. It's not an easy thing to do, but I still think we have to be respectful of each other.
Absolutely. It's a bit of a different world, and key to that, kindness, everyone. Practice kindness and wear that mask. Thank you so much. We'll see you again soon.